Introduction, Alexis. It is great to be here with you all today. It's interesting, as Alexis said, it's kind of coming full circle for me because I've watched this course grow from year to year, from this hodgepodge of lecturers that we threw together in 6 weeks in 2017 to this now well-established course, well-respected and appreciated course in its 4th year at SPH. And it's really been quite a journey watching this happen, and I'm so grateful that you are all a part of it. So just to give you all some context, when we started Epidemics of Injustice, the goal was to help equip public health students and practitioners and researchers with the knowledge and skills they needed to affect real social change out in the world. You know, we felt what Radical Public Health identified this gap in the curriculum. We were learning theories and methodologies, but we weren't learning what we actually needed to know to do the work and make the changes that we knew we needed to make. So Epidemics of Injustice was born out of that need, and to help equip us with the skills we need to really address those root causes of health inequity. And as we heard from Dr. Murray last week, this is not work that we can tackle alone. We need each other. We need to coordinate with other like-minded sectors, other like-minded organizations and communities to achieve our shared goals. But doing that work of getting all these people with different perspectives and different priorities on the same page, marching in the same direction, can be incredibly challenging. So today, I'm going to talk you through 2 tools that you can put in your toolkit that will help you bring together folks that have different perspectives, different priorities, different ideas, different backgrounds, and help create something out of those partnerships that is usable, productive, and effective. And the 2 tools I'm going to introduce today are the focused conversation and the consensus building workshop. So today I'm going to first start with reviewing the methods of the focused conversation and the consensus workshop. Then we're going to practice doing a consensus workshop all together. And then we're going to have a closing discussion. So I'll try to let you guys go for a break at some point while we're doing the practice consensus workshop. There'll be a natural break in there. So I thank you guys. It's going to be a lot of information in a small amount of time. If you have questions, you can definitely feel free to raise your hand. You can stop me as we go, because I'm just going to keep talking until someone tells me to stop talking. And I'm going to really try to keep that me talking at you to as concise as I possibly can, so that we can have as much time as possible to talk together. I want to give full credit to the Institute for Cultural Affairs for developing the methodology that we're going to be using today. This is part of the Technology of Participation series. And the values of the Institute for Cultural Affairs will kind of tell you how these methods came about and what the priorities were with creating them. So you can see them listed on your screen. We want inclusive participation, teamwork and collaboration, individual and group creativity, and not just thinking and talking, but actual action and ownership of those actions, as well as reflection and learning. And what we want to do as facilitators is to lead with the assumption of individual and collective responsibility, and to remain neutral as facilitators. And because we really want to be encouraging self-determination and fostering mutual respect among our participants. So I often joke in my role, as Alexis said, normally I'm in charge of strategic planning and COVID times. I am the community liaison on our COVID response work. So I bring together all of our community organizations and help them navigate all of their shared and conflicting agendas and objectives, get everybody lined up at the same tables that need to be at the same tables, and work with them to produce effective solutions that are meaningful for their communities. And I like to joke that I'm I'm a Yenta. I'm part matchmaker and part marriage counselor. So it's not just bringing the people together, but it's helping them navigate all of those tensions that exist. And they exist on multiple levels, whether that's interpersonal because they had beef with so-and-so from a different organization way back when, whether that's interorganizational from having, competition over resources or awards or whatever, or it might be, and we've been dealing a lot with intercultural drama and tension especially between our African American and Latino communities that have been historically pitted against each other. So being able to navigate those historic tensions and emerge from them in a productive way, in a healthier and more united way as well. So, does anybody have any questions before I jump into the methodology about any of that? Make sure I see that there's some chats. Oh, that's just sharing the resources. Thanks, Alexis. Alexis or Kelsey or Washika, I'm going to ask you guys to monitor the chat just because I don't have it open on my screen and to stop me if questions come in through there. All right, so let's jump in. The focused conversation. Have you guys ever been in a conversation where it was difficult to determine the point of the conversation, or where someone was dominating the conversation at the expense of everybody else, or where people talked and talked and talked but failed to actually say anything or decide anything? Yeah, me too. Lots, especially in grad school. The focused conversation model was born out of that challenge, and it provides an effective structure for productive conversations. So in a focused conversation, you carefully craft and order conversations to help participants achieve an intended discussion purpose. So you're not just talking for the sake of talking, you're talking for a purpose. And it works because it follows a natural human process of understanding. So consciously or unconsciously, whenever we are entering a conversation, we kind of go through this mental process. We observe who is present and who is talking, and then we quickly determine whether or not we want to listen to that person and whether or not what they're saying is we are interested in, or whether or not we like what they're saying. And then we interpret what they are saying and relate it to our own experiences, and then try to find meaning to it for our own personal lives. And then we respond in such a way of whether that's determining to just listen silently or engaging in the conversation or to leave the conversation. So this cycle is usually swift, it's usually unconscious or subconscious, but it occurs all the time. So focused conversations allow a facilitator to create this environment for an in-depth group thought process in a defined time frame. So it could be 20 minutes, it could be several hours, and it focuses on 4 basic types of questions that are presented in a specific order. So the acronym for that order is ORID. ORID: objective, reflective, interpretive, and decisional. These are the 4 basic types of questions. So objective questions ask for facts. They ask for information, sensory impressions. What do we actually know about this issue? And this is kind of your gimme question of, this is the easy low-hanging fruit of what is the objective truth? What do we know? And it's a way to bring people in to the conversation by giving them something easy to engage with, something obvious to engage with. And so objective questions really help set the stage for what that conversation is going to look like. The next layer down are reflective questions. And reflective questions ask for personal reactions, associations, emotions, and images. So it's really getting at, what does problem X remind you of? Connecting it, you're reflecting on your own experiences or on the experiences of your community that you're familiar with, and connecting that objective truth to yourself. The next layer is the interpretive question. And this asks for meaning, value, significance, purpose, and implications. So what options could we do about problem X? So we're taking stock of what's out there and what the options are. And then decisional questions we're asking about resolve, action, future direction, and next steps. This is what are we going to do about problem X? So an easy way to remember this, you can see in the parentheses on the left-hand side of the screen, is objective is the what, reflective is the gut, interpretive is so what, and decisional is now what. And in the handout that you have that's shared in the chat as well, that has that table of the focus conversation, it kind of lays out in greater detail. I'm not going to read through all of those different layers because you guys can do that on your own time. But it gives you some more guidance about what the intentions of those questions is. And then you also have a handout of sample questions for each of those layers to kind of get your wheels turning about what kinds of questions they're looking for. So when you're crafting your own focused conversations, you're taking this tool and applying it if you're facilitating a conversation, I want to encourage you to start with asking yourself why you are having this conversation, because you want to make sure that there's a point to this. We're not just having a meeting, we're having a meeting to do X. So the way you do this is by determining your aims. And there's two types of aims, and you'll see that in your table. There's the rational aim, which is the practical goal or goals that guide the collective thinking process by focusing the conversation. So that could be, we want this coalition to determine 3 things that we're going to do to address problem X. And then there is also the experiential aim, which is the intended effect that you want the participants in that conversations to have, whether that's a change in mood or motivation or perception. So your experiential aim could be, we want there to be a greater sense of group cohesion and group collaboration at the end of the conversation. And those aims and intentions will help you determine what the best types of questions are and how you should phrase them to help build that, to help move yourself towards those aims. So some other tips that I want to let you guys know is, as you work through your questions, you want to make sure that you're asking open-ended questions. Don't ask yes or no questions, and begin with easy questions that draw folks into the conversation. And if you're going to ask, what is the hardest part about this situation, maybe in one of your reflective questions, you want to make sure you're balancing it with a positive. What is the easiest part of this? So always balance your questions so you're asking good with the bad. And how many of you guys, just by show of hands or thumbs or however you want to do it, have experience with facilitation, with group facilitation or facilitating conversations? I'm seeing some hands, I'm seeing some shakes, some sort of. So being a facilitator, facilitator, the root of facilitator comes from the Latin word facile, which means easy. It's the same root of ease. And the goal of a facilitator is to make something easier. It is to help guide people along this process so that it is easier for them to get from point A to point B in their thought process. So when you're facilitating a conversation, that's why I said in the beginning, it's important to remain neutral, because you don't want to press your thumb too heavily on the scale in one direction, because then people are going to shut down because they're thinking, you're leading the witness. You're just trying to get me to agree with you. So you can structure your conversation, your questions in a way that helps guide people along a certain thought process, but you want to do that by helping to guide the conversation, not just by throwing your own opinions and dominating that process. So as you're facilitating a conversation, it's really important to establish that inviting and open atmosphere in the beginning by saying things like, everybody here has wisdom to share and there are no wrong answers, and really creating that welcoming environment where you're level setting everybody at the same point, where there's not a hierarchy of who is right and who is wrong, but everybody has mutual truths, and they can coexist. And don't be afraid to, if someone says something and you're not sure what they mean, you can ask them, can you tell me what you mean by that? Or can you explain a little bit more? And when you're closing a conversation, it helps to offer a statement of appreciation or gratitude for everybody's participation. You can say, here is what I heard, and kind of give a sentence about what you think where you think the group is in its thinking, or a bridge to what comes next. Now that we've had this conversation, we're going to take these results to this other committee and decide on X, Y, Z. So that is a focused conversation in a very small nutshell. And I want to pause and ask for questions.
And folks should be able to unmute themselves. Oh, go ahead, Sarah.
Yes, thank you, Dr. Grant. I was wondering if you could give an example of a time that you used this technique.
I just used one this afternoon, actually. So ORID is something that you can use all the time in a lot of different situations. When I did this technology of participation workshop, our homework assignment was to use an ORID conversation, with your spouse or your kids or your friends, because it really, it gets people thinking deeper. So I used it this afternoon. I sit on a community messaging and outreach committee for the Joint Information Center. And so the objective of our conversation was to figure out what are our priorities for messaging with community outreach, specifically for communities of color. And we're actually going to dive into this topic a little bit more in depth together. But I started with the objective of what resources do we know are out there already? Our reflective was, what have you heard from your community or in your experience? What has worked and what hasn't worked? The interpretive is, what are the groups that we want to prioritize for this outreach, within all the different phases and within all, who we know is getting vaccinated and who's not. And then our decisional is, what messages are we going to bring to the JIC, the Joint Information Center, to develop flyers that we can distribute to community members. So it was an hour and a half long meeting, and we went through those 4 questions, and we emerged with an answer to that decisional question that I can then take to the JIC so that we can create product that we can use for outreach for the community. That's a great question. Any other questions? And this it feels, when you first start doing ORID or any of these methods, it feels very forced and unnatural. And as you get more practice with it, it becomes more natural. Like a lot of times when you're developing a discussion guide, you might just naturally order things in an ORID fashion just because it makes sense. And that's the beauty of ORID, is that it's based on human behavior. It's based on decades of research. So it's very logical. It's very natural. So the other tool, the other method that I want to talk to you guys about today is the consensus workshop. And the focus conversation is a piece of the consensus workshop, so it feeds into it. So who here has been in a group where it seemed impossible to come to a decision, or where people had totally different priorities and little common ground, or where compromises were made that left people feeling like they were giving up something important with whatever the final decision was? So yeah, me too. The consensus workshop is a way to create consensus, meaningful consensus, in a short period of time. So true consensus means that all participants feel that their ideas and insights and perspectives and wisdom have been honored, and nobody leaves feeling like they had to give something up. And each member leaves that meeting owning the group's decisions. They experience an expansion of their own personal perspective, and they gain comfort working with others in the group because they understand where the common interests and the common priorities are. So again, this is a step-by-step process. This is a tool that you take, you put in your toolkit. I've used this method many times since becoming a public health practitioner. And it's really a great way to bring a diverse group of people to a table and leave with a solution or a decision that everybody feels happy with or satisfied with. So you can see on your screen, there is a layout of kind of the different stages of the consensus workshop. And you should have all received one of the handouts is the consensus workshop guide. And there are 5 components to it. Whoopsies. There are 5 components to the consensus workshop. The first is context. And that is about stating the purpose of the workshop, getting everybody on the same page of why we are here. Again, we don't want to just be talking for the sake of talking. This could have been an email. We're having a meeting to have a meeting because we need to achieve a goal. And then you want to start by leading a brief focused conversation about the topic. And this is really just to get people's wheels turning, get some conversation flowing, get people thinking about the question at hand. So whenever you have a consensus, whenever you are starting with a consensus workshop, you want to make sure that there is a question, there's a workshop question that you are going to answer by the end of that consensus workshop. So you start with your question. And it could be, what are things that we want to do to, how are we going to address the breastfeeding inequities among African-American women? What are we going to do to improve health literacy among whatever population? But you want to make sure that you are all familiar and it's explicit what that question is so that you're all moving from a same place of understanding about why you're actually sitting in that meeting. The next layer is the brainstorming layer. So you start this process of consensus workshop, I kind of imagine it going like in and out. You start with a group discussion, that focused conversation. You move to an individual level brainstorm where you independently and silently brainstorm your top 5, 10, however many answers to that workshop question. And it's really important that this is done. You start individually and you start silently to give people a chance to articulate their personal thoughts about that question so that as we're going through the workshop, they don't feel like they didn't get to, get down what was important to them. So after you've given individuals a couple of minutes to brainstorm their answers to their question, you ask each one of them to star their 4 or 5 best ideas. So they have to go through and they mine, that brainstorm, it's a brainstorm. All ideas are valid, but we want them to start, we want them to identify their 4 or 5 best ideas. And then in a small group, 2, 4, I would say no more than 6 people, you want to share those ideas with the rest of the group and have a conversation. And then within that small group, you collectively decide on a certain number of the most important ideas within that small group. So it could be a combination of, like, people could be saying totally different things. They could be saying very similar things, but you want to find ways to find those common grounds across what different people said were their best ideas. So we started with individual. Oh my goodness, I'm so sorry. I can't put that on my keyboard apparently. So again, we started with our individual brainstorm. Then we move to a small group brainstorm where you're sharing your best ideas. And then each small group is going to decide together what the most important ideas were that were presented by the other members of that small group. So that's our first baby consensus. Any questions so far?
Hi, this is Randy speaking. When you get to the end of that mini consensus, should you give some sort of guideline to how many ideas the group should settle on?
Yeah, that's a great question. And there's not definitive answer to that because it depends on how many people are engaged in the process. Ultimately, you want to have, I would say, 35 to 45 ideas from the entire large group. So depending on the number of small groups you have, you know, today I anticipate, how many people do we have on the call today? Like 60?
Yep.
So we'll probably have about 10 groups. So each group, let's do some math. I'm gonna ask each group to present their 4 most important ideas. Yes, that is good math. But so you're going to want to do a little bit of calculation to determine within each small group how many of those most important ideas from each small group will add up to create 35 to 45 ideas to contribute to the large group. You see a question from Amy?
Yeah, thank you. So I'm wondering, what's the range of ideal group size that this could, you know, in terms of how many people can participate in the conversation?
I've done it with as few as 8. You can do it with, I did one with 80. So it depends on the situation. You can also modify, once you get more familiar with the tool, you can make modifications about what makes sense. And this is usually, you know, in the before times, this would be done in a room all together with big Post-its on the walls and, you know, putting things up on the walls. We're going to do everything virtually. We're going to use Trello. You guys will see what that looks like. So you can make modifications, but it's really a versatile tool that you can adapt to different size groups in different contexts.
Great, thank you.
For sure.
I have a question.
Mhm.
So, how do you use techniques, or are there techniques for preventing the biases that, you know, have been documented socially from arising in the small group context, where like maybe 2 people suggest the same idea, but whoever has the sort of greater social standing in like a racist, sexist hierarchy maybe is listened to more? Or how do you prevent maybe someone who's less shy from dominating with their ideas and those ideas getting selected, not because they're the best, but because the person is more talkative or something?
Yeah, that's a really great question. And that's one of the reasons why you start in small groups. So the ideal size for those small groups is 2 to 4 people. You want to keep them really small so that there isn't room for, you know, groupthink or, you know, might versus right. So keep those groups small so it's a comfortable environment where people feel heard. And you start with that individual brainstorm so that people have time. You know, if you're someone that it takes a couple of minutes to really articulate your thoughts and figure out what you want to say, you have that time built in. So that's why that small initial group is so important, because it gives you that time to think and articulate your personal thoughts so that you can feel confident presenting them, and you do it in a small enough environment that there isn't really an option to, you know, skew the scale one way or another.
Yeah, that helps. I'm wondering then also if there's sort of, when you're having the groups present their ideas, are they encouraged to present individuals' ideas, or are they encouraged to sort of take a period of time to think about how maybe 2 ideas speak to each other and could be combined into one? And then
We will cover all of that in just a moment. That's
cool.
a great question. Oh, it says that I'm no longer sharing my screen. Sorry about that. Okay. So after that initial brainstorm you've given your time, it usually takes, I would say, no more than 10 minutes. You know, these are rapid cycles relatively, because you don't want to be there all day. And your small group has agreed on its 4 most important ideas. You ask the facilitator, you ask each small group to pass up or enter their 3 clearest ideas. So it's not about best, it's not about most important, it is the clearest ideas. And so you pass, and so we're moving from the brainstorm phase into the clustering phase. So you have everybody pass up their 3 clearest ideas, and you put them up all on the board, and then you start to form pairs. So you're going to ask which of these ideas are related. And it's not necessarily that they're saying they have the same words, but they could be related in other ways. They're targeting the same population, or they're using the same technique or something like that. But we're making pairs of related ideas. And you're going to repeat this. You're going to keep taking your list and asking, we're just doing pairs. We're not making triads or quads yet, only pairs. We're going through this series of filtering down ideas. So you're going to make as many pairs as you possibly can. And then you're going to ask all of the groups to pass up an idea that is new, that hasn't been said yet, that is different from all the things up on the board. So again, it's not a hierarchy of best to worst, it's different. What is different? And then you look at that list and you can start adding triads. Do any of these things go with any of our existing pairs? And then you're going to ask again, is there anything that isn't mentioned yet? So this is an opportunity that if in your small group, your idea didn't make it to your 4 most important ideas, but you still think it's really important, you can welcome that idea at that point. Is there anything on this board, or is there anything in your mind that needs to be up on this board that isn't up on this board yet? So you can provide that space for that, individual dissenter, if that, is a thing. So after you've gotten all the ideas up on the board, you've made as many pairs as you can, you're going to start combining pairs. So you can start merging pairs, and this is a very organic and iterative process. So you can take 2 pairs and stick them together. You can split a pair, put one here, put one there, and you'll see how this works as we do it together in our practice. But it's about coalescing ideas that are related to each other into clusters. And so as you do that, you might name one of the clusters with a term or a word that just helps you remember what that cluster is about, to help your group thought process kind of narrow down where things belong. But you're slowly combining ideas, and you're going to keep doing that until all of the cards have been put into a group that makes sense. So at this point, we're at the end of the cluster phase. All of the ideas have been connected to another idea. They're all in clusters. Then when we move to the naming phase, is really what we do to answer that workshop question. So the names of each of these clusters will be an answer to that workshop question. That's the best way that I can give you when we talk about naming them. You want them to be action oriented, because this is all about doing stuff. It's all about getting something done. So each of those clusters is going to be an objective or a tactic or a method or a strategy that you're going to use to address that workshop question. So again, this is about distilling thoughts down into logical groups of thought that make sense and that answer the workshop question. Y'all with me so far? Any questions? So,
Hi.
Go ahead.
Sorry, a little slow. It's Randy again. I got a little confused at one point. So after the brainstorming session where the ideas are shared, is the rest of it so far then in kind of the big group?
Yes.
Okay. That was just clarification.
Yep. You start with individual brainstorm, small group brainstorm, and then you get back to the big group. And that's when you pass up your 3 most important, or your 3 clearest ideas, and then the new idea, and then all other ideas. So most of this, the pairing and the naming, all of that happens in the big group. Great question. Any other questions? All right. And then the resolve section is really just that closure. It is about focusing the group on the outcome of that process, discussing the significance of the consensus, creating action steps. Okay, we have 6 clusters that are 6 steps that we want to take. Who's going to take ownership over each one, so that you leave with a plan, so that it was a productive and effective meeting, that you all leave feeling satisfied and like you actually accomplished something. That is the goal of the consensus workshop. Any questions about either focus conversations or the consensus workshop? And I will tell you, when I learned these methods, it was part of a 2-day workshop, and I'm teaching all of this to you in about 2 hours. So let it marinate, think about it, come back to the notes tomorrow, practice with it. It's going to take some time for it to really sink in. And if you have an opportunity to attend a technology or participation training, highly, highly recommend it. Should any tools be added to the process? Natalia, can you explain a little bit more what you mean about any tools?
Sure. So this process reminds me a little bit of design thinking. I'm not sure if everyone in the group is familiar with it. I know in my work, we use a lot of the design thinking process, specifically IDEO's design thinking, to come up with programming curriculum, processes for program implementation, evaluation. And one of the main tools that we use for design thinking are simple things that help us through the process of like Post-its, for example, to help us stay organized, and like worksheets that complement each step. So I was wondering if this consensus process would recommend incorporating similar either physical tools or electronic tools.
Absolutely. This is a very visual process. So if you're doing this, traditionally, what you would do is you would take regular 8.5 by 11 sheets, cut them in half, and each one of those half sheets would have one of those ideas on them, so that and you write on it with a big marker so you can see it from far away, and you stick it on a wall. You tape it up on a wall, or you get a sticky wall. So it's very visual, and you can actually move them around on the wall as needed. You can use colors, you can use labels, but absolutely, I encourage you to, this is not a cookie cutter. You're going to want to adapt it. You can add in other tools, other skills, whatever you think would be helpful to the situation to make sure that your audience and your participants are engaged, and feel like the material and the conversation is accessible. Thanks, Natalia.
Thank you.
All right, in the interest of time, I want to move us over to practicing this. So we are going to do a practice consensus workshop on the topic of how can we assure equitable access to the COVID vaccine for communities of color. Now, this is a very topical conversation, and we know, actually, I'm not going to say anything. We're going to have our focus conversation about it. So what I am going to ask, we're going to have the focus conversation in the big group. I know there's a lot of people here, a lot of thoughts, a lot of ideas. I'm going to keep this conversation short, just so that we can kind of walk through it together. And then we're going to send everybody out to breakout groups that Kelsey's going to help us with. So I have laid out, normally if you're facilitating a conversation, you're not going to put all of the questions, and this is objective, this is reflective on the board for everybody to see. This is just, I want you to see my thought process so you can learn from it. So we're going to start with our objective question. What do we know about the challenges that communities of color face in getting vaccinated?
I also have a question really quick to kind of to focus that more. So
Please.
Are we talking globally? Are we talking nationally? Are we talking just in Chicago? Because those could be different depending on the context of them. So I guess to contextualize that question, that could be really broad. Yeah, with that. Yeah.
Great point. Let's talk Chicago. Let's keep it local.
Are we supposed to answer, or are we supposed to write it down?
this is our focused conversation that we start the consensus workshop with. So this is a conversation that we want to have together. So please, we're not brainstorming yet. This is not a rhetorical question. I would like to engage you all in a conversation about this. What do we know so far about the challenges that communities of color in Chicago face in getting vaccinated?
One of our students said medical mistrust. Someone else said trust. Someone else said medical health disparities. So yeah, trust is a big one. Accessibility issues and trust due to history of how medical fields have mistreated Black, Indigenous people of color, misinformation, distribution through practitioners, not everyone having regular health care, lack of access to health care, limited access to healthcare institutions, health coverage, or healthcare coverage. Brandon raised his hand. Would you like to also answer? You can.
Yeah, I actually just noticed that I sent it directly to Alexis, but my bad. My answer would be transportation boundaries.
Mm-hmm. Someone also said lack of historical lack of cultural competency, access and mistrust, healthcare coverage, redlining and the effects of it. Mm-hmm.
Absolutely. All very valid and legitimate. Mm-hmm. So now we're going to move down to our next layer. Mm-hmm. So I see also costs, not getting time off of work, lack of access to broadband, lack of luxury and time. Yes, absolutely. So now we've done our objective. What do we see in our community? Now let's bring it personal. Which of these challenges feel most critical or most pressing for the Chicago community? So I see a question, are we including incarcerated peoples? I'm going to let you interpret that question. If you define that as a community that you're serving or that you're connected to, you can absolutely answer from that perspective. Washika, do you want to keep reading out those answers?
Yeah, I was on mute and I was reading them and realized you could not hear me. Yes, lack of clinics close to home, getting information out, access and results, mistrust in the medical community. There's very little communication about how this is getting distributed. If people don't have a reliable employer or healthcare provider, they may have no idea about opportunities, lack of equitable distribution. And I will just, well, no, I won't. That is an issue, and thankfully I have reliable, but you're right, there's an issue with that. Language needs, disability, yes, so access, different types and different definitions of access, lack of cultural competence.
Yep. So now we've connected it to what we feel is most important or most pressing.
Mistrust, access, lack of information. Sorry, just wanted to throw that in.
Thank you. And now we're going to move down a layer to the interpretive. This is the so what. So what root cause challenges or root cause issues led to these challenges, or what values are reflected in these issues? White supremacy, systemic racism.
Structural racism. Waiting for some more to roll in. Racism, capitalism, medical experimentation on Black, Indigenous people of color. Lack of insurance coverage. For-profit healthcare, unethical studies like Tuskegee, mishandling of the distribution of vaccines, profit over people in healthcare and other industries, medical inequity, structural determinants of health, lack of representation of Black, Indigenous people of color in vaccination studies.
The exact term is escaping me for some reason, probably because I'm searching so hard for it. But what is the term for when areas lack hospitals and institutions? When there are large areas that
a healthcare desert?
Thank you, healthcare desert.
Yeah, I was thinking that might be the term too, because I'm more familiar with food deserts. Sexism, racism, and ableism, disproportionate policing, incarceration in Black communities, miscommunication from public health officials, medically underserved areas, recent fear by immigrants caused by federal policies, lack of Black, Indigenous people of color among healthcare provider community.
Yep. All very valid and insightful comments. So now that we, have this understanding of where this is coming from, now what? And I'm going to say, don't answer this in the chat because this is our workshop question. What do we need to do to address these challenges and assure equitable access to the COVID-19 vaccine for communities of color in Chicago? So what's going to happen in just a minute is that Kelsey is going to break you up into breakout groups, and you're going to all start with your individual brainstorm. So I want you all to sit and write down or type it out, whatever's comfortable for you, 6 to 10 ideas. It's the brainstorm, all ideas are valid. Just start writing and see what happens.
Really quick, Anna, could you repeat that slower so I could actually type the question in the chat for those who might need to see it again?
Absolutely. What do we need to do to address these challenges that we all just discussed and assure equitable access to the COVID-19 vaccine for Chicago's communities of color? Got it?
Yeah, I'm just fixing it because it looks awful because I don't know how to spell.
So individual brainstorm, 6 to 10 ideas. And I'm going to have you guys facilitate this. I'll send, or I'll have Kelsey send pings to you all after a couple of minutes to kind of shift gears. Then you're going to star or highlight your 3 best ideas from that list. And you're going to share that with your small group. And then your small group together is going to determine your 4 or 5 most important ideas that you're going to share with your large group. And that's where I'm going to give you guys a break, is once you're done with that, we'll give you guys a break. What time is it now? It's 6:20. So we're going to come back together at 6:35. So you have 15 minutes in your small group. The brainstorming and the discussion should take about 10 minutes. So that should give you guys about 5 minutes to take a break afterwards. So we'll all come together at around 6:35 or 6:36. So if you have any questions, I'll stay in the chat with Kelsey and Washika and Alexis. You can always raise your hand and ask for help, and we'll figure it out together. So Kelsey, do your magic work. Send everybody out to their breakouts. I'm just going to type the directions in the chat for everybody again.
Do we want 10 breakout rooms, Anna? Or 5? Or how many are there, Kelsey?
There should be 10. Yeah, each group should be about half the size that it is.
Okay.
Okay, sorry about that. Misunderstood. I have 10 people in 5 groups.
Yeah, we want 5 people in 10 groups.
I just realized everyone could hear me clicking my pen.
There's also a question if one person within the group is supposed to be facilitator or if it's just collaborative. Why make new groups?
I think I got bounced from my group. I was in group 4.
Same here. I was in group 2.
Yeah, sorry about that. We're going to try it with smaller groups. So you'll get a new invitation in just a moment.
Ah, okay. Thank you.
So much easier to do some of these things in person.
Before I put our ideas in the chat, can I say something really quick?
Please.
So in our group, we talked about, understanding what it would look like, one, to create these spaces, right? To brainstorm against addressing these challenges. But something that I brought up is that we have to move out of the idea of scarcity and that these aren't really challenges. These are deliberate decisions to strip and deny Black and Brown and people of color the opportunity to so-called ideas of life, liberty, and pursuits of happiness. And that even though we sat and we did brainstorm, we ended up coming up with 4 things. There are people who are not interested in creating spaces of safety and wellness for Black, Indigenous people of color, and therefore brainstorming is amazing and a wonderful thing for us to do. But it is foundationally something that will be thrown from underneath us because we live in a society that is inherently racist, capitalist, ableist, white supremacist, and interested in the destruction and marginalization of Black and Brown Indigenous bodies. So I'm gonna drop what we put in there in the chat, but I just wanted to make sure I said that there's no such thing as scarcity, like the shit exists. And I told my mom before the COVID-19 vaccine came out, because she doesn't feel like getting it. And I said, well, if it didn't work, they would have sent it all to Black countries first. And she was like, cool, maybe I'll get it. And I was like, yeah. So, yeah.
Thank you so much for sharing that. I really appreciate it. And it's a really important comment. I want to, as we're collecting these responses from everybody, we can continue this conversation if anybody wants to respond.
I guess I could say, temporarily taking my educator hat off, that there is a very similar concern. Like these decisions were made. And we need to recognize that this didn't happen by mistake. And I think that some of the chat things, when we talked about white supremacy, racism, structural racism, and capitalism, we do recognize the ways in which they work together now and historically. And I think that Dr. Murray got to that too. That there were choices made and they knew what these choices meant, right? It wasn't that, oh, if we redline people and put better resources in better neighborhoods, what's going to happen to those who don't have it? There was a choice made. And I think that we do need to talk about that, especially with the history of medical experimentation and eugenics and how those all work together. Some of the books that were suggested from the last class that are both in the chat and on the book list do address those too. So if students want to kind of look more into the history of the choices that have been made, especially medically or public health wise, I would do so. I would encourage y'all to read those books or gravitate more toward those books. But also, yes, we do need to have conversations about who's made the choices, how those choices were made, and also how, even though we're talking about Chicago is still still within a Western country, and many Western countries have been buying the vaccines. In other countries are saying they may not get it for till 2022. Yeah, so someone said accessibility, like, accessibility of locations. Yeah, and you said it's ableist. I'm glad you included that, because even though disabled people are seen as they're getting more priority, one, how is that disability defined? And two, even though you can make an appointment, is it somewhere you can actually get to? Would also be something. So I'm really glad that you've brought those up, and also the reason for the class. We recognize these were choices that were made, and that people knew the consequences of those choices. And I'm glad that we kind of understand that that's a thing too.
I don't want to interrupt this conversation. I just real quick, Kelsey, do you see how I'm organizing these comments on the Trello with one idea per line?
Yes.
Okay, thanks. Continue.
No, that was it. I was done.
And bear with me. Oh, go ahead, Aaliyah. Looks like you want to say something.
Yeah, I was just gonna say. So I'm an alum of the MPH program, and have actually transitioned to a role in as a diversity and inclusion practitioner at a healthcare organization. So it's so interesting because I see so much intersection between, the work, the public health work, and now the work that I'm doing in terms of diversity, equity, and inclusion. And so the comments that you just made are so real, right? And there's so much work to do. And I think we've got to start by just acknowledging the history, acknowledging everything that's happened in the past, that continues to happen every day, that will continue to happen tomorrow until the structures that are in place and are dismantled. So I just think it was, the comments were just spot on, and that I'm just really enjoying being part of the conversation today.
Thank you for that. All right, I'm just trying to make sure that we've got all these ideas up on the board. Kelsey, who are you at?
I just finished up at Brian Laura.
Okay, I'm doing Kim's. Normally this wouldn't happen, but since we're doing it virtually, just bear with us.
I had a question that all of you, while they're organizing the Trello, if you would like to share with us your experience of sharing in the groups. Remember, we talked earlier about the fear of being overtalked, or the fear of other people's ideas being chosen because they were more vocal. And did anyone have any insights they wanted to share for us, or any kind of examples of things where you talked and how you all decided to reach a certain type of consensus, or any kind of themes you saw overlapping in your suggestions?
Yeah, I can kind of chime in on that. So we were actually talking about when it came to the distribution, a couple of us, we pretty much all kind of have the same general ideas when it came to sharing, just kind of presented it with a couple of different words here and there, but it was all kind of general the same. And when it came to the access part, I had shared that it was kind of like a double-edged sword, especially with communities of color, because it's like the idea could be like, oh, if you're giving it to us first, that means if it doesn't work, that they're trying to kill us off or something's going to happen to us, versus, oh, if you give it to their communities, if it does work, it runs out. Now we don't have the access to it. So it's like, it kind of goes both ways when it came to that accessibility. And that's how we kind of flushed that out. And it wasn't to disregard anything, but it was like, because I'm in a community of color, that's how I thought. I'm like, it can go either way when it came to that access part. And explaining about, like, when it came to the health literacy, we always think of Tuskegee as the first thing, but I think making clarification about how the differences of that Tuskegee experiment from this one, because that was my first thought too. I'm not gonna lie, like, oh, Tuskegee, but it's like, once you continue to have dialogue, virtually, and on social media, you get more clarity about like how there was a vaccine and it was the neglect of how those people are versus there is one and it's kind of quote available, and I use that loosely. So I think that's one of the biggest things, especially in the Black community. That's the first thing we're thinking about is Tuskegee. And that, that's always, even though the semantics are not always clear, but of course, those of us in academia, we kind of do know the differences when it comes to that. But those that are not, they're gonna be like, oh no, they're not gonna, do me like this, So I think it has to be more clarity when it comes to the way the health literacy, the information is disseminated to the communities. Like it has to be specifically tailored for the, the education level, the SES level. All of those things have to play a role in how the information is disseminated.
Absolutely. Thank you so much for that comment, LaShonda. So in the chat, I want to keep us moving because we have a limited time together tonight. In the chat, I post a link to our Trello board, and this is what we're going to be using. I'm also going to share my screen for those of you guys who don't have Trello. Kelsey, I think I got all of them. I think we're good on all of them. There was one that was really long. The really long responses I didn't put in. I will say as constructive feedback for everybody, when doing this activity, it helps if these brainstormed ideas are like 3 to 10 words. You want it to be very clear, very concise, because it will help with the process if you can fit your idea on like a little card. Okay, can you all see my screen? Yes?
Yes.
We can see you can see the Trello board?
Yes.
All righty. So
for those who cannot, could you explain what we're supposed to be seeing?
Absolutely. So what you would see on your screen is one column on the left that says our workshop question, which is how can we assure equitable access to the COVID-19 vaccine for communities of color in Chicago? And beneath that, we have little cards with each of the ideas that were presented by the small group. So every idea is a different card, not like group 1 has 1 card, group 1 has 4 different cards. And we have other pages or other, if you're imagining like large sticky notes that say clusters A, B, C, D, E, F, G, H, I, J, K. I think we stopped at K. So what we're going to do now is we're going to be looking in this first column with all of these ideas, and we're going to start to make pairs of ideas that are similar or related. So for those of you guys who are in the Trello, I see there's about 15 people in the Trello itself, or you can just look at the chat from the Zoom chat. If there are ideas that you think belong together, shout them out or type them out, whatever is good for you. And we're going to start putting these ideas into pairs. So which of these ideas do you see that have things in common? And I'm going to help with this just to keep us moving along. So I saw a number of things about transportation. So I see a transportation here, which says ensuring transportation. And then there were some other. Oh, and then I saw mobile vaccine clinics. So even though these aren't the same idea, they're related in the sense of moving people or resources around together. So what other things belong together? And Washika, I'm going to ask you to monitor the Zoom chat so I can keep up with everything.
Yes, I was going to say the theme of incentivizing vaccines. That's what someone said.
Okay, so we need specific things. And for those of you who are in the actual Trello board, if you want to help me make these clusters, just because we got a lot of things here.
No cost.
Okay, see.
Cost related to the vaccine or cost information about that would be good too. Community engagement, spreading of information through trusted sources and community leaders. So that would go in with community engagement.
Okay, so churches, faith leaders, stakeholders, community members. So we're doing this process not quite the way it should be done, big air quotes around that. Normally you would just start with pairs, but we've got limited times, we got a lot of hands, so let's do this quickly so that we can get to talking about what we want to do.
Someone had a question, how on the process, how do you handle disagreement on cluster themes?
That is a good question. And usually as a facilitator, what you're going to want to do is ask, what do these things have in common? And try to highlight if it's a word or an idea, and get the people who are disagreeing to articulate what they think the underlying theme is. And if they have totally different perceptions of what that cluster is about, maybe they need to be separate clusters. Maybe that doesn't make sense. But as a facilitator, as you're building these clusters, you want to make sure you're reading aloud each one of these cards that's going together and asking, turn to your audience and say, does this make sense? Are we in agreement about this? And look for confused faces, look for, like, what the hell she's talking about. Yeah. So read body language, read expressions, read the room as you're making these clusters to make sure that you're capturing all of those thoughts. So thank you guys looks like we've got a lot of stuff. So I want to pause for a second.
Oh, I was going to say there was another question. I can wait.
Yeah, let's start with a question if it's about the methodology.
It was, yeah. So can something be in two themes? Do you just have to choose one? The other one is, do you go in with a determined, idea about the clusters, or do you wait until you get your responses to make the clusters?
You wait until you get your responses. Everything is organic. And that's why you start with the pairs, because you don't want to say, okay, now we have a transportation theme and we want to see how many things we can fit in there. So you start with the pairs so that you can really evolve organically what things make sense together. So let's pause for a second and let's take a look at group A. So we've got ensuring transportation, mobile vaccine clinics, mobile clinics, transportation vouchers, accessibility, a centralized place for people to sign up, internet masks, PPE through UPS, vaccine distribution centers similar to voting, changing the built environment, accessibility, location of vaccine clinics, home visits from home healthcare workers for vaccinations, making clinics more accessible, and accessibility. It's a lot of stuff under one cluster. So I'm going to ask you a couple of questions. The first is there a word or a label that we want to give this cluster?
Someone said access, someone said accessibility. A few people said accessibility.
All right, let's go with accessibility. That's a great label.
Want to, well, it's also kind of broad. Do we want to say geographic accessibility? Because information accessibility might be different than geographic accessibility. So, and we may have another cluster that's like, well, information needs to be accessible and disseminated. So, someone said yes, good call. I like that. Okay, thank you.
Great.
So, are you saying that there should be an area for accessibility of information and accessibility of?
I was thinking maybe.
Can you hear me?
Yeah. You cut off for a second, and then I was nope, you're on mute again. But yeah, before LaShonda responded, you had cut off, and so she had started talking, but you didn't finish. Still can't hear you.
Sorry, I'm having audio issues.
You're good now. That was fine.
Yeah. Okay.
Sorry, so you can just type what you wanted to say in the chat and I can read it. LaShonda, what did you want to say really quick? I'm so sorry.
No, it's okay. No, now because you did kind of make that more specific. So if there is other types of accessibility in that cluster, do we need to move it now? Because now we've named it geographic. So it may be some other things in there like internet mass, PPE through UPS. Oh, well, I guess that's through the distribution? Because I would think that would be more a different type of accessibility now. So now we have to restructure these things again if we start,
absolutely. So I'm gonna move PPE masks back to our bank here, because you're absolutely right. Again, this is an organic, iterative process. You can move. The reason why we do this with sticky notes or on Trello is because we want to move stuff around as our ideas develop as a group. So great point, LaShonda. Anything else in this first column that you think doesn't belong in geographic accessibility? All right, let's move on to cluster B. We can keep it there for now. We talked about churches and leaders and faith-based groups, training community leaders to educate people on vaccines, culturally sensitive education to their groups, engaging community leaders in vaccine education and distribution, localized communication campaigns to enhance vaccine literacy developed with communities, including counter messages, televising champions, selecting trusted, culturally linguistically appropriate marketing channels, leadership from BIPOC communities, selecting trusted, culturally linguistically appropriate marketing channels. Oops, this one, let's edit that one. That's actually 2 ideas. Localized, it looks like we duplicated some of these. Reach out specifically to community leaders and give them a platform for communication. Stakeholders / community members representative of their community. Get input from local communities about preference, where distribution locations could be set up to put in places that are accessible and tailored to this per ward. Leadership from BIPOC communities. Engage trusted community members to create a network of ambassadors. Engage community stakeholders, hyperlocal communication and distribution. Engage trusted community members to create a network of ambassadors. I'm going to delete that one. Reach out to community leaders. Oh, we got that one too. All right, so what word or words would you give to describe this cluster?
So we actually had a suggestion.
Okay.
Cluster B, competent and trusted information sources. Someone had a comment and asked if transportation vouchers seemed like more of an incentive than, geographic accessibility. Someone agreed. Someone else said community-based education. Someone also said cultural competency. Someone else said trusted health communication channels, community engaged communication. I like that one too. That was cool. Yeah. I mean, these are all really good. Great. Community input / leadership, culturally competent care. Oh.
Any of those stand out or some hybrid of those? I heard community-based, culturally competent, tailored.
I was going to say something. It has to be either community, something with stakeholders.
Mm-hmm. Well,
community stakeholders.
Yeah.
Sorry to
Someone
interrupt.
said competent. Sorry.
I just wanted to say that for me, it felt like there was 2 separate potentially issues here. One was providing culturally competent care. The second was identifying a community-based group to maybe leverage to deliver some of the messaging to the community. So potentially 2 different themes.
Mm-hmm. Yeah, so I see what you mean. It could be 2 different clusters, or you can put slash like culturally competent care or messaging, like you said. Yeah, so messaging and cultural competent care. But yeah, someone said 2 different clusters would be better for that. So yeah, perhaps. And I think that that's really great about the process, that we're all reading through it and trying to come up with something together.
So I put culturally competent messaging and then culturally competent messengers.
Okay.
We're seeing some nods. So let's move over. So like these ambassadors we would want in the messengers, hyperlocal communication distribution. Moving some of these over. You guys can feel free to help me. Train community leaders to educate. Churches, leaders, groups. All right, so it looks like we're separating those 2 out. Just keeping my eye on the time here. We're going to move over to cluster C. So in cluster C, we've got incentives like money for work, pay people to get the vaccine, employer pay, creation of incentives program, make the vaccine 100% free, free vaccine. What word or words do you think we can stick on cluster C? Incentives, affordability. Let's go with incentives.
Sorry, my mic cut off. I was reading and it just, yeah, so
That's
cost, incentives, affordability, inclusivity. That was interesting,
Yep.
cost and incentives.
So I want to be clear about what we're doing right now is we're still in the clustering phase. So this is the names that we're giving these are like temporary placeholders to help organize our thoughts. So these are not the final names of these groups at this point. So let's go to cluster D. Increase production of vaccine on a macro federal scale, transparency, accountability around adverse reactions, funding to health departments and federally qualified health centers, ensure Mercy Hospital gets funding. What word or words comes to mind with this cluster? Capacity building, policy. I like capacity building. Let's go with capacity building.
There we go. Yeah.
All right, cluster E, removing barriers to literacy, audio information playing in common area, ensure language, culture competent outreach program, brochures, ad campaigns, culturally sensitive education around the vaccine, culturally competent communication and distribution apparatus, inundation of information around the community regarding safety and realistic expectation, using a trauma-informed perspective on all.
Let's see.
So I see one
someone, okay, are we on? Sorry, someone directly messaged me and it threw me off. Where are you, what's the last thing you were able to read, Anna?
I read out cluster E, but it looks like there's some questions on the capacity building one, whether transparency fits in there. What do you guys think? Does transparency begin in a different cluster? We've got, should we move it back to home base for now?
Yeah, I think so.
Home base.
Mm-hmm. Yeah, oh, there we go. Someone said health literacy.
I need a bigger screen.
Cultural humility. Ooh, I like that. I like that.
For cluster.
I'm just meaning in general, I like that word, but also maybe, yeah.
For cluster
I'm going to write that down. There are some ethnographers who need to hear that word. Another class.
Yeah, that's what I was talking about when it came to the competence word, because that's like it's never an end to competence. Humility is an ongoing process. Mm-hmm. So that's why I was using. I know you're saying that if these are just preliminary, but that was the biggest issue I had with the competence.
Yep.
Because it gives off the vibe of like it's a checklist, and once I've completed all this, I am now deemed culturally competent. Like, you know.
Right. Absolutely. So I have a question for the group. What is the difference between the cultural humility and I'm going to move this up here. Where did it go? And our culturally competent messengers group.
So that's what I kept pointing, Anna. I was like, can we move this over or merge?
What do you guys think? Are they the same or are they different?
I think when we take into account what some people have said in the chat and also LaShonda's like commentary, I think that they would be different, right? So culturally competent messengers, those people are embedded in the community. These are the people we're thinking who are already embedded. They are the community. They're not just, I'm a part of the community. They are the community. And then when we're talking about messaging, especially from people outside of the community, those people are the ones who really need the cultural humility.
Right. I actually wanted, and these are the two that I meant to put together, the culturally competent messaging. Maybe I shouldn't have given these names, given these such similar names. Messaging versus cultural humility. Same feedback, Washika?
I guess similar, yeah. Someone said, I think in that case, cultural competency is appropriate because they are literally from the community themselves. Yeah, so people who the messengers, I think so, yeah. And then, I'm sorry, Ashley had a comment. Oh, what about cultural responsiveness? Someone said a previous stakeholder suggestion might work as a title because stakeholders are as community messengers. Oh, thank you. I'm glad you liked my explanation. Yeah.
All right. So
Yeah.
am I?
So I'll just expand on this a little bit because one of the things I was thinking about was using individuals in the community, arming them with the information to serve as sort of, community lay health advisors. So I don't know. I'm seeing a lot of duplication between the message itself and that cultural humility.
Well, see, I guess the thing about it, the messenger, if it's, let's just say, for example, if it's like a faith-based leader, if they're going to use the actual community members, I would think that they would not need cultural humility because they are technically of that community, because they know exactly what the community is, because they are specifically the community, especially with the stakeholders. I think when it comes to the humility part, is part of, let's just say, like researchers or people, others, quote others, that may not understand the dire needs, like, as opposed to being a part of community and like we technically really know what the needs are. Like, you get the gist of what I'm trying to say?
Yeah, that the messenger really matters because it totally changes the dynamic.
Definitely. Yeah, it definitely does, because the messenger, especially if they are from community, I hate to say they're the representative, because I always use that joke in my classes that I'm not the Black people's representative, but I saw your face, Washika. But I think when we do hear from our own, or those of us that identify with the community, it does give a little bit of more resonance and validity to the message, per se.
Absolutely.
Yeah.
Thank you for that. So I'm. Should I change it? Well, let's go a different direction. I have my eye on the time, and so I'm going to move us to the next phase of this, which is the naming section. And so with the naming section is when we look at these clusters and we name them in a way that answers the workshop question. So let's take a look at our first cluster, which we temporarily called Geographic Accessibility. So I want you guys to take a look at all of the things that are in this card here, this geographic accessibility pot, ensuring transportation, mobile vaccine clinics, transportation vouchers, accessibility, vaccine distribution centers, making clinics accessible. How can we turn that into an answer to our question? And think about it as starting with a verb.
Sorry, there's some chatter outside, but I can read. Somebody said mitigate barriers. Someone said providing.
All right. We can do providing, ensuring geographic accessibility.
Yeah, sorry, that was the other one. Approaches to accessibility.
Again, we want to make sure we're starting with a verb because we're going to turn these clusters into actions that we're going to take.
I guess approaching would be the change. I don't know.
Yeah. The name should be, yeah.
Oh,
so that's what we're going to be doing. The question was, should the name be one specific actionable strategy? Yes. Each cluster is going to represent a strategy that we're going to take. So this one to me is all about making sure that people can actually physically get the shot in their arm.
Or the shot can get to them.
Or the shot can get to them.
Okay.
Making the vaccine geographically available, removing barriers to access, create pathways to vaccine accessibility. I like that one. Let's go with that for time. All right. Let's look at our next cluster. This is our cultural humility cluster. It's got removing barriers to literacy, ensuring language, cultural competent outreach program, culturally sensitive education, culturally competent communication distribution apparatus, inundation of information using trauma-informed perspectives. How can we describe this cluster in a way that answers our workshop question?
Could it be delivery of cultural I don't know how to not make humility culturally humble messaging.
Deliver culturally humble messages. What do people think about that one? Culturally humble, I'm seeing also responsive.
Practice cultural humility. I like that. Deliver culturally inclusive messaging. Yeah.
All right, let's keep going. Next cluster that we have, we're going to skip around a little bit because we don't have time to do all of these, I don't think. We're going to go to incentives. How can we describe this cluster in a way that answers our workshop question? This has incentives like money for work, paying people to get the vaccine, creating incentive programs, making the vaccine free.
We have, where are we? Provide incentives. That was
or maybe
one.
incentivize.
Removing financial barriers.
Ooh.
That part.
Remove financial barriers to the vaccine. Let's go with that. Let's jump over to the culturally competent. I'm going to bring this up here. Culturally competent messengers. So this has engaged trusted community members to create a network of ambassadors, engaging community leaders, churches, faith leaders, reaching specifically to community leaders, hyper-local communication, training community leaders, leadership from Black, Indigenous people of color, engaging community stakeholders. How can we describe this cluster in a way that answers our workshop question?
Engage community stakeholders, engage and empower community leaders, engage the community, recruit community leaders.
I'm going to be a little bit more specific because we're not just recruiting them, we're recruiting them to be the messengers.
I was going to say teach.
So I put engage or recruit community stakeholders to deliver/teach messaging to the community.
Yeah, a couple people liked empower.
All right. And then let's do one more. Let's do the capacity building one. Increase production of vaccine on a macro federal scale, funding to health departments and FQHCs, ensure Mercy Hospital gets funding. How can we define this cluster in a way that answers our workshop question?
Someone said fund capacity building. Advocate for, build capacity in ways that support communities of color. Yeah, someone else agreed they liked advocate for.
Yeah, and remember, these are strategies that we're going to take on. We don't necessarily, like our group, for whatever this group is, probably can't fund these places, so advocate for is probably a more appropriate word choice for that. Advocate for increased funding or resources to support communities of color. All right. So I'm going to stop here just for the sake of time because I want to recap a little bit. Ideally, when you're doing this, we would have put these guys in their own cluster or figured out a way to integrate them into the other clusters, but we just ran out of time. But so now I'm moving into the resolve. part of the consensus workshop. So as the facilitator, I'm going to provide a quick recap. We started with this conversation about what can we do in order to assure that all individuals that are all members of communities of color have access to the vaccine when they are eligible for it, when they need it, in a way that makes sense for them. And we talked about, and we came up with the following ideas that we can act on as a group. We are going to advocate for increased funding and resources to support communities of color. We are going to create pathways for vaccine accessibility. We're going to deliver culturally humble, responsive, or inclusive messages. We are going to engage and recruit or empower community stakeholders to deliver or teach the messages directly to the community. And we're going to remove the financial barriers to the vaccine. Is everybody here in agreement with these strategies for addressing this question? Or does anybody disagree with these strategies? Or is there anything that we missed?
Why won't
All right.
A couple people said yes.
Getting some thumbs up. Now, the next phase of this, hypothetically, this is our action group of what we're going to do. I would go around and ask each one of you to take a Post-it and put your name on it and stick it on the objective that you are willing to take responsibility over. And then we could break into next week, you're each going to meet with your subcommittee and come up with a list of tactics that you're going to use to get your objective done. So you want to make sure that you're leaving the consensus workshop with actionable steps that can be taken to move your project forward, so that people feel like we're moving in a direction that makes sense. And that is a hyper-condensed teaching and experience of the consensus building workshop. Congratulations, you guys, you made it through. So again, ideally we would have like 2.5 hours to do this part of the workshop, like this practice workshop itself. We wouldn't be so rushed. We would start with the pairs and build up the clusters more organically. We wouldn't have 6 people doing the pairings. We would have 1. We would have conversations about them, making sure that everybody was in agreement with the clusters. We would have longer conversations about the names to make sure that everything, makes sense to everybody. But I want to ask you guys with this. Let me see. I can keep sharing that. Can you guys see this now? That's okay. So we got about 8 minutes left. I want to make sure I get you guys out on time, but what was that like for you all? What was that experience like?
Someone said there are a lot of amazing ideas. Can you speak to accountability with regard to the individual tasks?
Absolutely. That depends on the structure of the group that you're working with. And it helps to set concrete action steps for those groups. Like, so as you're closing out the session and you're in that resolve, by X date, each group will have met and will have come up with 5 tactics that they're going to do. So leave with concrete steps so everybody knows what is expected of them.
Rusha said it was a little overwhelming, but great. And then I know Amy had a question. And then there's something else there's 2 more messages in the chat.
Yeah, thank you, Wakisha. So I have I'm sorry, what did I say?
You said Wakisha, it's Washika.
I'm so sorry.
Yeah, that's why I prefer Miss Torres. It's
okay,
much easier.
Sorry about that. So my question is, right, we were sort of coming up with ideas that potentially, had no barriers on resources. So, right, so we were talking about, mobile vaccine clinics and, community workers and things like that. How do you scale that if, to fit the resources that you have available?
So there's a whole nother series that we can do on action planning, which is about how to operationalize this stuff. So the answer is there's a whole process that you go through to figure out what is reasonable, what is feasible, what resources are available, what resources are potentially available that you just need to unlock. But I unfortunately don't have enough time to go through what all of that is, but you would, this is about getting the ideas down, and how you operationalize these is a whole nother discussion. And you might need different people at the table for that conversation. So you're going to want to kind of build this in phases. I saw another question in here, like, how do you move along? And so I want to emphasize that this is an iterative process. And this is, we started with getting the ideas down, figuring out where we want to go, and then actually making it happen is a whole nother step in the process. And trying to jump, we often have this desire or this impulse to jump right to action, to do what is easiest, what is fastest. Let's get those low-hanging fruit going. And the problem with that is that we never get to thinking about those root cause issues, those underlying challenges that are affecting the problem. And we don't think strategically about what needs to happen to make the greatest impact in that issue. So that's why going through these steps and really thinking through all of the different options, talking to different people, getting different people's perspectives and thoughts out on the table, and having them understand that there is alignment. Even though we come from different organizations, different sectors, different races, different ethnicities, we have areas of common alignment across ourselves. And it's about finding what that is, lining ourselves all up in tandem, and leveraging, not trying to homogenize what everybody is doing and saying, okay, now your organization that usually works on housing is going to have to do all this other stuff. It's about leveraging the unique capacities, capabilities, skills, resources of every organization in a strategic and collaborative way that makes sense, that allows for a greater collective impact together than what would have been able to be accomplished if each organization was working individually. So I strongly encourage, if you're interested in more about operationalizing this stuff, to look into the collective impact framework. There's a whole ton of resources out on the internet about it, but that's a framework that's used for solving complex problems, complex like community level problems. Complex problems require complex solutions. That's a huge takeaway that I want you guys to take from this. And getting those complex solutions is a process. And using these tools as a way to guide your coalition or your group of people through a process to get to the point where you're ready to leverage your collective, your individual resources for that collective impact.
Yeah, I actually put what you said, the phrase collective impact framework for solving complex community level problems in the chat. So it will be in the abridged chat that comes later tonight. Someone else said that they actually did like that the format was shorter because it made you get to the point. And someone said that they'd wish some of their other, the past Health Chicago 2020 meetings had something like this. Yeah, so yeah, I think we're really glad you liked it, and y'all can find ways to implement this. But yeah, so like I said, I put the framework part.
Thank you.
Every alderman of every ward. Yeah, thank you so much, Anna.
And I will say that I've used this consensus workshop. So I facilitate the community health improvement planning process for Lake County, and we've used this consensus workshop on 3 separate occasions so far in different modifications of it to identify the vision and the values, as well as our health priorities and the top barriers to health that people were facing. So you can use it in all these different settings as well.
Yeah, someone said thank you for so much time and work and making this virtual. Yeah.
Thank you guys. It was truly a pleasure to be here with you all tonight and to share this skill. It really is so valuable. And again, practice makes perfect. Play around with getting that ORID framework in your mind. Think through and talk through your process as you're building a consensus workshop. Use the handouts that I gave you. There's some great tips and tricks on there. And let's go out there and get people working together. That's what we need to do.
One quick last question. Well, someone had asked, how and where did you attend a training to learn this method? So maybe let people know, I guess, or search terms to look for so that they can also find this kind of training.
So it's the Institute of Cultural Affairs with the Technology of Participation. That is what it's called. It's a facilitator training. And honestly, as a public health practitioner, meeting facilitation, being able to facilitate group processes has been an invaluable skill. I use it every single day, and it is so, like, once you start being a good facilitator or see a meeting facilitated well, you realize how scarce of a resource that is in the community. And it really is an opportunity for public health to serve as that central convener to bring all those people together and to help guide them through this process to have an outcome that works for people and for our community.
Great. Yep, and then see people saying thank you is very helpful. Yes, thank you all so much. And Sammy had a question, but just I guess.
Yeah,
really
I will
quick,
say,
Sammy, and then sorry.
Yeah, I offered to Alexis and I say Miss Grant and Miss Torres that I'm happy to stick around for 20-30 minutes to answer any other questions that you guys have, whether that is about my time at UIC being a dual degree student, being a radical anti-racist, anti-capitalist government bureaucrat, helping to build a course. I have a lot of experience in different areas. I helped to organize under the GEO strike a couple of years ago, putting together a community health assessment with that. And yeah, I'm happy to be here. I'd love to share whatever knowledge I can impart your way. So I'll
Sammy,
stick around if anybody wants to talk more. I would usually be like, let's all go down to, what's that bar on Taylor Street called? Know what I'm talking about? Maybe it's closed.
I hope it's
I know what you're talking
Drum and
about.
Monkey, because the other one has a Blue Lives Matter flag. I was like, yeah, I think Drum and Monkey may be closed. Yeah, it did close.
Oh, sad. It would have been Drum and Monkey. Like, let's go down there and grab a drink. And
Taylor Street Town. Thank you for the suggestions.
Yeah, so feel free to grab your dinner, grab a beer, whatever. We'll keep it cash and hang out.
I think Sammy had a comment, but I'm gonna just step away for a moment. I'll be back.
Please, Sammy, what's your question or comment?